Good afternoon. I'm April Watts with Magic 95.9, Baltimore's best variety of R&B. Welcome to GBMC's Facebook Live. And this time we're going to talk about flu and cold season because it's that time of year. And I have an amazing expert with me here today, Dr. Theodore Bailey. He is an infectious disease physician for GBMC. How are you today?
I'm well. Thank you very much for having me, April.
Yes. And you look amazing and you have great information. So let's get right into it. Who is vulnerable to flu and colds?
Can I answer that with a question?
Sure.
Who's invulnerable to flu? And the answer is actually nobody.
Wow.
But the question's more interesting than that because there's a question of who's the most vulnerable and who's less vulnerable. But really, nobody's invulnerable, and that's one of the keys to public health policy for vaccinations. The people who are the most vulnerable are sometimes the youngest people, sometimes under age 2, and some of our oldest people above 65.
And is that because they have weaker immune systems naturally, just due to age, or?
Yeah, so the younger folk haven't yet developed a fully functional immune system, and the older people, it starts to deteriorate. But in between there, you also have people who are immune suppressed. They might be people with leukemias or lymphomas or on medicines that reduce their immune system for various reasons, like rheumatoid arthritis. Pregnant women are also very vulnerable to severe flu.
Okay.
So there are other healthy in-between people who can be very vulnerable to it.
Okay. Now, this may seem like a dumb question, but I was taught a long time ago there's no such thing as a dumb question. What exactly is the flu?
So
people use the term all the time, but we don't know what it really is. What is it?
All right, it is. And I get that question a lot, and it is used in a very wide range of ways. But to use it technically, we're talking about a very particular type of virus.
Okay.
And it's the influenza virus. And now what makes it complicated is that the influenza virus can cause a wide range of different symptoms, and we can talk about those as we go along. But there are other viruses that have some overlap in terms of how you feel when you have them, like the cold virus.
Right.
There are also what we call the stomach flu.
Yes.
And that's, we know what that is. That's nausea, it's diarrhea, all the things we don't talk about at the dinner table. But those are typically not flu. That's typically a range of other viruses. But the common denominator, usually when we use the term flu loosely, what we're talking about is something that's going to give us a fever. We're going to feel really run down. We might have aches and chills. We take to our bed, we cover up, and that's usually when someone's going to use the word flu. The difference is that of all of those, it's the influenza virus that can really be seriously dangerous to health. And in fact, there's high mortality rates worldwide. Sometimes as many as 1.5 to 2 million severe infections a year worldwide, and sometimes as many as 500,000 deaths can result, at least indirectly, from influenza.
Wow.
We've had, just to go back in history, in 1918, there were estimated 20 million deaths from flu. Now, that was when troops were mobilizing and carrying it all across the globe during World War I. But that just gives you a sense of what it can do. And we don't see that with stomach flu and the common cold.
Right. We want to thank you for watching, and I just want to encourage you to interject with questions, and we will address those questions as well as continue with the conversation that we're having right now, because this is certainly interactive. I have questions. We want you to ask your questions as well. Now, why are vaccinations recommended every year for the flu?
So we treat flu a little bit differently, right? We don't hear about vaccinations for the cold, vaccinations for the stomach flu.
Right.
So one thing is these other things we often don't have a vaccine for. The other part is that there's not necessarily a call for it because these other things, stomach flu, the cold, are not so severe that there's that much to prevent. They make us feel bad temporarily, but we know that we're going to recover from them. But with an infection like the flu that can kill people, there's a lot of need for something that can prevent that. And then we also have to be able to do it, and we have been able to develop a vaccine. Now, what does that do?
Right.
So what it does is it boosts our own immune response to the flu.
Okay.
And our own immune system is designed to, when it sees an infection, not only respond to it right then, but leave behind a lasting response that can be geared up quickly and more effectively. And that's the basis for all vaccines. And it's fortunate that we've been able to find a way to do that for the flu. We've been able to do it for other infections as well, the ones that we're familiar with from childhood. Now, why flu is different than the others, so we don't get vaccinated every year for everything that we get vaccinated against, right?
No, we don't.
And the reason why is that the flu is particularly changeable. It mutates very quickly.
There's different strains, right?
Well, there's different strains, so there's diversity. But even in a single strain, from year to year, it's going to change dramatically. And so the vaccination you got the year before, it's still there. You're still making those antibodies, but the virus itself has changed. And so your immune system will no longer recognize it or recognize it effectively, and your response to the next infection will not be as effective.
Okay, so I'm taking notes here, and I'm getting that a cold is usually not fatal, and the flu can be fatal. But what are some other ways that colds are different from the flu?
Okay. Well, one is we don't have a vaccine for the flu.
Okay.
Two is it is a different virus. We call it the rhinovirus, and there's a number of other viruses.
Okay.
So at a very scientific level, it's different. It's different genetically. You know, these are not things that we can notice in our day-to-day life. They're too small, but that's part of the basis for why they're so different. And the cold virus doesn't change as much.
Okay.
The thing that really makes the influenza virus so dangerous to us is that from year to year, it can change itself dramatically at the genetic level. And so it can elude our immunity from the year before, whereas we gradually become immune to things that we see over and over again if they don't change that much. Flu is one of those things that changes dramatically.
Wow. Now, I've heard that there's no cure for a common cold. Are there treatments for colds?
Well, there are ways to try to reduce the symptoms. And in that sense, if we separate out treatment from cure, and cures are a special case of treatment, then yes, there are treatments for the, we take things that can reduce the fever from a cold. And those are things like Tylenol. We can also use those for the true flu as well. Sometimes zinc-based medicines, over-the-counter cold medicines, will help feel better or shorten the symptoms, but there's no real cure. There's not a medicine that directly attacks the cold virus and eliminates it from the body. But in some sense, there's no need for it because our immune system is able to do that work for us.
Now, we have a question from the audience.
We do. This is from Smith Lovely Bessie. And have you found a way to give vaccines without giving the actual virus directly to the person?
So there are a number of vaccines that have that property. So there's a wide variety of ways of giving a vaccination. One of them is to give a weakened but still live version of the virus, of a virus. And if you guys remember, there was an inhaled version of the flu vaccine a few years back. It's still available, but it's not currently recommended this year. And that was a replicating virus. That was a virus that was similar to the flu virus, considered not to be severe, but it would be something that if you got it, it would go through several cycles of replication, and it was a live virus. We use for most vaccinations something called an inactivated virus, which doesn't have all the necessary machinery to replicate itself. So it gets into you, but it can't multiply itself. And so that technology does exist, and it's commonly used. Now there's a third version where you're not even giving it a virus. You're actually giving a piece of a virus to somebody as part of a vaccine, because what you want to do is trigger the immune response to that part. And then whenever you get really infected, your immune system will recognize that part on the virus and attack it. So in that case, you're not even giving a virus. So there's that whole continuum of virus that can replicate, a virus that can't, and no virus at all.
So does that explain why some people say the year that I got the flu shot is when I got the flu, because they were given the virus and it just kind of like kicked in? So how does that work?
Very good question, and that's certainly something that people remember when they had it. And it can be a couple different things. So one can be that obviously with the flu, there's several different strains and they mutate. So even in a year where you get vaccinated, we know that the overall effectiveness is not 100%.
Right.
So it could be that you've gotten a different strain of the flu. You've gotten a strain of the flu that's mutated from the one that you've been vaccinated against. Or three, because we use the word flu loosely, you've actually gotten an infection with another virus.
And it wasn't the flu. Yeah,
and vaccines for the flu will not protect you against things like the cold or other respiratory viruses.
Okay. Vaccines are more of a preventative measure. Are there treatments for the flu once you get it?
Yes, there are. Now, those treatments are, as with any treatment, also somewhat imperfect. What they are, the main one is something called Tamiflu, or oseltamivir, but there are a few others. That one's a pill. There are inhaled versions and injectable versions. And what they can do is, for someone who's already been infected with the flu, already starting to have symptoms, is shorten the duration of the symptoms. And sometimes blunt the severity of them as well. Now, that's not as good as not getting it in the first place.
Right.
But we do have that as a backup mechanism. And we also can use that in some situations as a preventive. So in people who've been exposed to somebody known to have the flu, and they're a close contact, usually a household member, somebody who's at particular risk of severe disease from flu can actually take those medicines preventatively at that time to try to prevent it, because they know they've been exposed. And if the flu gets into them at a moment where they have that medicine in them, they're less likely to become severely infected.
There are a lot of people that are moving more towards homeopathic remedies and things of that nature, but with the flu being such a serious illness, would you as a medical doctor advise people to not go see a medical doctor if they have the flu? You see what I'm saying?
Yeah.
Like, people don't want to go to the doctor and they don't want to take medicine and they don't want to take flu shots. could that be very, very dangerous for someone to do, is what I'm asking.
Yes, it could be. And I would point out that there's not any mutually exclusive nature to homeopathic approaches and
Right.
common modern medical approaches. And we
They
know
can overlap and merge.
And we know that the modern medical approaches do make a significant impact on the frequency of infection, the severity of the infection, and also, how long it's going to last.
Right.
So, I would not. This is, as I said, historically a type of virus that either can kill people directly, or sometimes what it does is it's a 1-2 punch, and it weakens your lungs enough. It renders them much more vulnerable to a secondary infection. And then that secondary infection actually is a bacterial infection and will require true antibiotics. So, trying to avoid, modern medicine is not advisable.
Okay. Now, what about pneumonia? We've talked about colds, we've talked about the flu. How does pneumonia differ from the flu?
Great. So another term that's floating out there, we hear it a lot, and we may use it loosely sometimes. No, pneumonia simply means an infection of the lungs themselves.
I see.
And there's we talk about bronchitis. That's an infection of the tubes that run down to the lungs. So in most cases, a pneumonia is going to be a bacterial infection along the lines I just talked about. Influenza can be a lung infection, so you can get it down into the lungs. But usually we reserve the word pneumonia for the bacterial infections.
Okay.
And those are ones that in some cases we have vaccines for. Strep pneumonia is the most common bacteria, or not the most common, but probably the most notorious bacteria that causes pneumonia. We do have vaccines for that. Well, what happens after flu, to tie that in, is sometimes you'll go from flu to pneumonia.
Okay.
The lungs and the airways are weakened. They're not as able to clear things out. They're a little bit boggier. And so inhalation of some bacteria at that time that normally wouldn't cause trouble will actually start to multiply and actually lead to an even more severe infection. And for that reason, we actually keep statistics of kind of flu season respiratory mortality. We don't really say, is it flu or not flu, because often what gets the person at the end isn't the flu, it's the next bacterial infection. And it's one more reason for the vaccination to make you not get that second infection.
So is it true that the flu vaccine isn't very effective this year? Because we had something going on around here. I don't know what it was. I can't say it was the flu, but it was something. And several coworkers caught it. People caught it twice. I caught it twice. And I was like, what is this? It's like a weird strain of something. So is the vaccine very effective this year?
Well, in terms of just protecting against some respiratory infection, it's not going to be effective because it only protects against that one thing called the flu. So in that sense, no, it's not going to prevent you from having respiratory illnesses during this time of year. Now, for the flu itself, the thing that we should measure it against, how effective is it going to be? This is something we have to rely on statistics. And in this case, infections are a lot like sports. I mean, you can see a good performance, a bad performance, but really you have to take it in context. You have to look at the whole season, look at, is that a good batter or a bad batter? You can't judge it by a single at bat. And what I would say is we saw last year in the U.S. that people that got the flu vaccine had roughly 30 to 40% fewer infections than the folks who didn't. So in general, it's about that effective. You say, well, that's 30%, but if you are an MLB second baseman, hitting around that much is going to get you a large contract. And it's the same. Flu is a moving object. It mutates. It's evolved to try to elude everything. It's like a living curveball. And so if you have something that can prevent it 30% of the time, that's something that's pretty effective. Now, this year in Australia, we've heard some statistics that they're seeing an inordinate number of cases, higher than usual. And so we may have some, at least in Australia, we may see some strains that are not fitting underneath the vaccine. But what's going to happen in the U.S. is often different than what's on other continents. So we may see strains that do fall under it. I would still recommend it. And again, we don't know until afterwards, when we go back and look at the statistics, just how much of an impact it made. But if the person, we know that everyone who gets the flu got it from someone. And if that person is that 1 in 10 person or 1 in 20 on a bad year who wouldn't have had it if they'd been vaccinated, that makes a big difference downstream. Uh-oh.
No, I don't have the flu, I promise.
Okay.
I just need some water. I don't have the flu. So we are currently in flu season. Is it too late to get the flu shot? No, it is not. So we do recommend, CDC I should say recommends, and public health officials will recommend late October as the time to get it. And part of that's when it becomes available. Because each year we have to study what the new flus are, what they look like, and then develop a vaccine for the ones that seem like the most likely to cause trouble. So late October is usually when it's considered time to start vaccinating. But the flu season is going to run through the spring.
And so getting it now will still give you protection, the protection that we can get. As I said, it may be imperfect, but still in the range of 30% typically for the remainder of the flu season, which is several months down the road. We know that it takes about 2 weeks to get the full benefit of the vaccine.
Okay.
So, right now I would definitely get it, but the sooner the better. But even so, by 2 weeks from now, we're talking about the new year. You're still talking about being protected in January, February, March.
Okay, cool beans. So we've talked about all of the benefits of the flu shot, but is there ever a person or a time or a certain candidate that the flu shot is unsafe for?
Great question, and the answer is yes. We know that people who've had previous severe allergies to the flu vaccine or somebody who should not get it on an ongoing basis. We know that there are certain ages where it's not useful. So for infants below 6 months of age, it's not recommended. Their immune system's not going to respond to it. We also know that people with Guillain-Barré syndrome, that's a kind of paralysis that comes on for reasons we're not always sure of, are also people that probably should not get it.
Okay.
And that's on a case-by-case basis to be discussed with their doctor.
I haven't gotten a flu shot in years and years and years, but there are some people who say that when they get their flu shots, people ask them if they're allergic to eggs. What is that about?
So this goes to what a virus is. A virus is not really a freestanding living thing. It can't replicate itself by itself. So it has to replicate inside of a cell by kind of hijacking the machinery of the cell to make copies of itself.
Oh, wow.
So for us to make the viruses that we use for vaccines, we have to replicate them in cells. And so in this case, the flu has been replicated in egg cells, embryonated egg cells. So some little bit of egg protein often accompanies it as a result of that.
Okay.
Now, the CDC has changed its recommendations in the last few years and now feels that people with egg allergies can take this. There's two caveats. One is if the allergy to eggs is fairly light, like it's no more than a rash, then that's somebody who can simply have it by their recommendations. If somebody's had some more severe types of reactions to eggs, then that would be somebody who can get it but should get it in a supervised medical situation. So they should get it in a doctor's office. They should get it in a hospital. They shouldn't get it at just a drop-in
CVS or something.
CVS, not to pick any particular site, but just to, this doesn't have on-site medical personnel, and they may benefit from being observed. The CDC says not necessarily, but what's the harm in waiting around a bit? And 30 minutes tends to be the time frame that we see most reactions.
What would you say to a person like myself who is skeptical of the flu shots to get me to go ahead and get a flu shot?
All right, that's the challenge. That's where the rubber meets the road. And what I would say is, like anything else, these are not 100% effective. So part of the skepticism sometimes derives from, well, I got sick. I actually got the real flu after that. But we simply know that we would love to have something that's 100% effective, but that doesn't exist. So we know that we're reducing by, say, 30% with the vaccine, statistically. Now, that 30% over the very large number of people I say could get severe infections in a year worldwide. We're talking about over 1 million. You're talking about chopping out 300,000 of those. And the thing is, you may not just chop out that 300,000. Those are the ones. The thing is, if those people don't get it and don't transmit it, you may be chopping out even larger. You may be paying downstream dividends. If you have loved ones, if you're around folks that are elderly or very young, coworkers who you're on good terms with, you're doing also a certain kind of public duty as well in having the vaccine, because it reduces, and they would be doing the same. If you guys do it collectively, the odds of two of you at the same time getting it, spreading it to the next person becomes much lower.
We need to do that here then.
That's
whatever we had has been going around, and it has just been circulating and circulating. This has been an awesome conversation. Do we have any more questions? Is there anything else that you want the viewers to know about the flu that we haven't covered?
One thing. So something as simple. We've talked about kind of high technology, talking about vaccines, but some of the preventive stuff is actually the lowest tech in the world, which is to say, just good hand washing, after contact with public surfaces, things like that. If you can keep that up, that's an important part of prevention.
What about those hand sanitizers? Because a lot of times people like to use those, and sometimes I think people use them in place of washing their hands. It's just like,
they're actually very good.
Okay.
And the influenza itself is a kind of virus that takes a little bit of when it leaves a human cell from replicating itself, it takes a little bit of the membrane with it. And a lot of these alcohol-based antiseptics really dry things out, and things with the membrane are particularly vulnerable to that. So it's for bacteria, but it can also have some benefit there.
Okay, good stuff. Well, thank you so very much, Dr. Bailey. Once again, it's Dr. Theodore Bailey, infectious disease physician at GBMC, and we'll be back the third Thursday of January to talk about another health-related issue that affects you.